Welcome to Navigating Hope, your compass to health empowerment. I'm Dr. Jamie H.O.P.E, steering you through healthcare, overcoming overwhelm, personal goals, and emergencies. We'll navigate the healthcare maze with actionable insights and real-world advice, unlocking the secrets to a healthier, more vibrant life. Join us to take control of your well-being and make informed decisions for your health and your future. Stay with us as we unravel the mysteries of medicine, wellness, and life's unforeseen challenges, helping you bypass the ER with a dose of knowledge. Stay tuned till the end of the episode with a recap of your actionable insights and a free gift. Let's chart a course to your well-being together. Everybody, welcome back to another exciting episode. I am so honored to be joined here today by Janet Philbin. So she is a licensed clinical social worker, and she helps people break free from the painful stories of their past. She is also a certified hypnotherapist and certified conscious parenting coach. Janet specializes in healing emotional pain and trauma. So keep listening if you've experienced any of that in your life. With over 25 years of experience, she runs a private psychotherapy and hypnotherapy practice, helping clients worldwide achieve transformational healing. Janet is the author of Show Up for Yourself, a guide to inner awareness and growth, a best-selling book that provides a framework for emotional healing. She integrates her clinical expertise with her personal experience to guide others on their healing journeys. Janet collaborates with Dr. Shefali Sabari. Did I pronounce that right? How do I say that?
Sabari, but you could even just say Shefali.
Dr. Sabari.
You just
Shefali, okay.
Dr. Shefali, it's fine.
Yeah. Dr. Shefali. At the Conscious Parenting Coaching Institute, and which we're going to learn more about. And she's been featured in various media outlets, including Newsweek and Brains magazine. So many accolades, qualifications, certifications. Janet, thank you so much for being here with us today.
Oh, thank you. I'm really excited for the opportunity.
And so let's dive right into your origin story. So you help people with healing. What was it that made you passionate about it to take this approach with multiple tools in your tool belt to make such a difference in people's lives?
Yeah, that's a great question. I think we can help people heal as much as we ourselves have healed. And that's an important thing to remember. So when I was in social work school, I had to take a class on child development. And this class was unearthing memories of my childhood that were very traumatic that I didn't think were still impacting me. I never dealt with it, but I thought I had taken all this trauma and said, okay, you go in a box over here in the corner of my brain and it's gone. Well, that totally did not happen.
Wait, you're saying that doesn't work?
Didn't work. So crazy. Here I am, 22 years old, having flashbacks to childhood. This isn't good. That got me into therapy. I finished my MSW, began working. And over the years, especially once I developed my private practice, I needed to learn more. I was helping people with death and dying. That was my thing. I was a hospice social worker, but more and more trauma was crossing my path. I wound up working with patients going through infertility, which is all about loss and trauma. That was a specialty of mine for many, many years. But I still had not, even though I'd been in therapy many years, hadn't fully healed the trauma. And no one ever, I hate to be a Debbie Downer, but we don't really ever fully heal. I think we are always in process because healing isn't a destination, it's a journey. So through my own journey, which started at 22, getting into therapy, doing group therapy, learning to become a hypnotherapist, and then was a hypnotherapy client myself, that enabled me to really find, hold, and heal. And she's still healing the inner child within me. So I never ask my clients to do anything that I wasn't willing to do myself.
Oh,
And
that to me is so beautiful. So not only you've walked with people through the darkest parts of their life, hospice, end of life, infertility, trauma, and you're not just one of those people like who's like a practitioner, you know, eating a donut and smoking a cigarette and saying make healthy choices. That kind of hypocritical. You are doing the work along with everybody.
exactly. And that's what I've done. And that's sort of what even led me to conscious parenting, is because I'm a parent of three young adults now. My two oldest are in their 20s, and my youngest just finished her freshman year in college. And when my youngest was 11, I, by happenstance, was introduced to Dr. Shefali's book, The Awakened Family. And I said, well, I'll get that book. And the book's a few inches thick. I'm an avid reader, and I read it in about 2.5 weeks. And I started applying the principles in the book with the things I was struggling with my child at home. And I began noticing shifts and changes. So I had to learn more. And then she opened her coaching institute, which I became a student of and have just been involved with it ever since, as an advisor in the institute and helping to train other students. So like you ask about the origin story, I don't really feel like there's one origin and one story. There's been many iterations of myself over the years on a personal level and a professional level. And because of the work I was willing to do, that I really had to do, or I would not be here functioning in the way I function now, I had to do all these different things, and I had to find a way to weave them together.
Nice. Just like the journey that your clients and your patients go through.
Correct.
That is so beautiful and inspiring because it really does help to be guided by somebody who has some level of understanding of what you're going through and have had that struggle.
Yeah, it's very real. I worked with infertility patients because I went through my own 4.5 year journey of infertility. So when my patients would sit down and talk about their IVF cycles, I would say, I get it, because I used to sit in that chair.
Yes. And it does make a difference. I experienced a lot of struggles while pregnant. I was very sick while pregnant, but I had zero issues getting pregnant. So it's harder for them to relate if somebody like me were trying to heal them through an infertility journey. Now, if people want to complain about barfing through 9 months of pregnancy, give me a call.
You're going to be my go-to person for that one,
Yeah.
Jamie.
We all have our things, right? But I love that you took your pain and created such beautiful purpose around it.
Thank you. Yeah.
So let's look at some of the amazing tools in your tool belt. So you do some really cool stuff. And I did ask you for permission for this before we turned on the recording. Hypnotherapy.
Yes.
Now, there are a lot of people who have some pretty interesting misconceptions about this. So you, I assume, do not make your patients cluck like chickens or convince them to do silly stuff. So can you take the opportunity to educate us on what hypnotherapy really is? You can't make people do things against their will. Like, can you please walk us through that?
Definitely. Thanks for the opportunity to demystify hypnosis and hypnotherapy, because there are so many misconceptions, really because of the movies and media, and people think I'm going to take a pendulum or a watch on a chain and go in front of their face and they're going to pass out. So hypnosis is simply an altered state of consciousness. And all hypnosis is self-hypnosis. So that means no one can be hypnotized against their will. And in hypnosis, you cannot be made to do anything that goes against your values or ethics. If I put you in hypnosis and I said, pick the pocket of the person over there, and that was against your morals, you would not do it. So hypnosis is something we all go into involuntarily throughout the day. Have you ever driven to your destination and you get there and you look around, you're like, oh no, I don't remember driving here. But
Oh, Lordy. Yep, I've absolutely done that.
yes, that is an altered state of consciousness. You come out of the movie theater at 3 o'clock in the afternoon and you're shocked that the sun is out. You were in an altered state of consciousness. You're reading a book. Someone speaks to you. You don't hear them. Or these days you're on your phone. Someone's talking to you. Why don't your kids hear you when they're watching social media or playing a game on an electronic device? They're not in their conscious awareness in the moment with you. They're in an altered state playing a video game. So we have to bring someone back from that.
Yeah.
But,
so we want to enter it for certain specific things, but we also want to get out of it for certain specific things. So walk us through when we want it and when we don't. We should probably not want that while we're driving.
You do not want to be in hypnosis while driving.
Yes.
Meditation is an altered state of consciousness. Hypnosis is just taking it a little deeper. Sleep is not hypnosis. When you are in hypnosis, you are not asleep. So if you're in hypnosis and the hypnotherapist is counting you back, 5, 4, 3, 2, 1, no matter how deeply relaxed you were, when the hypnotherapist says 1, open your eyes, you open your eyes. If you don't open your eyes, then yes, you've fallen asleep. They're different.
Yeah.
They're different. So you can fall asleep during hypnosis, but hypnosis is not sleep. It's different. You are in complete control when you're in hypnosis. So though I might be talking to a client with their eyes closed, they can pop their eyes open at any time. They can end the session at any time. You don't have to answer a question. You're always aware of what's happening. I am never, ever telling anyone, you're not going to remember what happened in hypnosis today. To me, that would be unethical. I had a client one time, she was a breast cancer patient, and she was coming in to work on her anxiety. And as we can all imagine, someone with breast cancer is going to have increased anxiety. And after the first hypnosis session, she had her hand on my doorknob at my office, and she goes, "Wait a minute, are you sure I was hypnotized? I heard every word you said." Like, I never told you wouldn't hear me. But she was so surprised because people don't know what to expect.
Right.
About hypnosis, but it is so powerful and so transformational because the way I work, and not all hypnotists or hypnotherapists work the way I do. I won't do fluff. If you want to lose weight and just have some very strong post-hypnotic suggestions for weight loss or smoking cessation, I'm not your person. Go to a hypnotist who just does that. If you want to lose weight and you want to understand why you ever began to gain weight, what was at the core of the disordered eating, then come to me. And
nice. You're really about the root cause, with all of your modalities that you use.
Absolutely. Yeah. Yeah, because that's how we create change. And that's how we create lasting change.
Because, and I've seen,
yeah, go ahead.
So we're having a little bit of an internet glitch. I've seen that with my patients, though, that are trying to make those changes. And I think about it like the difference between real lifestyle changes and the fad diet kind of change, right? You can change temporarily. You can lose weight on any nonsense BS fly-by-night diet. You can. And then as soon as you stop, it comes back. So what you do, this is not, a fad or a Band-Aid. This is that deep healing so the problem stops persisting.
Correct. Exactly. Or we make a drastic change so that you are coping better, more effectively in your life now. But healing does not happen in one session. So I will never take a client for only one session. I do require people to do a minimum of ideally 6 sessions. 6 sessions seems to be the sweet spot for hypnosis. Do people stay with me longer? Yes, but I would say the overwhelmingly majority of my clients see real significant changes, reach their goals in 6 sessions. And though I'm a traditionally trained clinical social worker, I went to a, top tier university in New York, insight-oriented therapy in the way I was trained, I believe after all these years practicing, has its limits because the conscious mind is always going to get in the way. So what we can do in 6 sessions, maybe 10 sessions of hypnotherapy, that's 2 or 3 years of weekly psychotherapy.
Wow. And I appreciate the level of honesty and integrity, because there are a lot of snake oil practitioners who say, oh, come by one really expensive session with me and it'll fix you until the end of time. And that kind of nonsense is what led me to starting this podcast, because I want real, honest practitioners. And the truth is, you cannot fix things and you cannot heal in one session. It's something that, it's like a muscle. We were talking about that beforehand. If you want your bicep to be stronger, you can't just do 1,000 curls in one day. It's that those tools over time. And so during your sessions and afterwards, what kind of homework do you have your clients do to really help strengthen that muscle of healing that they're doing?
Yeah, it's a really good question. I always ask my hypnotherapy clients to journal immediately after the session, just to write down anything they remember from the session, any insights they've had, anything at all that whatever wants to come, just to free association, right? And then I do like people to journal in between sessions. What are the things you've noticed? What's still stuck? What's new that's come up? What was an aha moment? What's still triggering you? We could talk more about triggers if you think that's important for your audience to understand. And this way we can use that as information for the next session. Because I never know, a client's going to come with a goal. I had a client that had a really, really bad phobia for vomit, and she had little children. Well,
oh Lord, that's does not mix well.
Child that doesn't vomit, we're going to have a problem. So right. That was her overarching goal. And I think I don't remember, I think we did 5 sessions. We did 5 sessions and there's no more vomiting issues for her at all.
Wow.
She can be with her kids, she can hear someone gag, cough, but we had to get to the root origin. And so now she's not even getting triggered by those. But so after the first session, I needed to know, okay, what else is coming up? What else is triggering this panic about vomit? What other feelings happened within you? What were other awarenesses you had? So then we can that directs the session. I don't direct a session. I don't say, okay, we did this last week, so we have to do this week. No, I'm just a guide, but the client is really in the lead.
So not only can they not be forced to fall asleep, forget stuff, do stuff against their will, they're staying in that autonomy the whole time. It's a personalized session. It's not just a one size fits all that you could just watch a recording of this silly pocket watch thing. You are using your skills as a licensed clinical social worker in addition to this.
Correct. Each session is personalized. No 2 sessions will be exactly the same. Yes, is there a format? I'm saying with air quotes for those who aren't watching. I follow, yes, because there has to be. There's a beginning, middle, and end to every hypnotherapy session. So it has to have a certain way that it works in order to achieve the healing. But what comes out within the session then orchestrates where I'm going next. Right? Just like a physician, you start with the presenting problem, but all of a sudden the next visit, there's 3 more symptoms. Well, you're not going to ignore those symptoms just because the presenting problem was what it was. So it's the same kind of thing.
Yeah, exactly. As a diagnostician in the emergency department, they might have one specific symptom. And if we anchor on that and say, okay, there's only one cause for that, you miss, countless patient stories, and that stopping to listen, to individualize, personalize, those are the marks of an excellent practitioner. That's why we were so excited to welcome you on the show.
Thank you. Thank you. Yeah.
So let's talk about triggers. And I think, first of all, I think sometimes people might be overwhelmed and not realize it. I remember a very hilarious, I can look back and laugh now. My kids were toddlers. We had 2 big rescue dogs. And if you had asked me minutes before this, like, are you overwhelmed? I would have been like, no, of course not. I'm amazing. I can do it. All the nonsense we tell ourselves, right? But then just the tiniest little thing. And all of a sudden I started yelling at the kids, like, why are you guys being so childish? And then the dogs were barking. And I'm like, and you, why are you barking? And then fortunately, I have done some work, some personal work. So I was able to, in the moment, realize that I just criticized children for being childish and dogs for barking. And I think the problem was me, not them. So I was able to kind of, laugh, take a deep breath. And I'm like, you know what? I think of the four of you, I think mommy's the one that needs a timeout. So how can people recognize that they're even in overwhelm? And then let's get into some triggers.
Yeah, I think your example is perfect. We don't a lot of times realize we're in overwhelm until we're in over our head. And that's the problem, because we live in a place of reacting and instead of responding. And the way to help yourself, like a little life hack, to give your listeners a life hack, the most powerful tool to help you regulate your nervous system, because it's your autonomic nervous system that goes haywire, okay? Your sympathetic nervous system goes off the charts. You go into fight or flight, dogs barking, kids crying. We lose our bleep and our mind and yell and scream. And I've been there and done that all too many times, which is what led me to conscious parenting. But the most powerful tool, and I call it in my book, the purposeful pause. We must pause, and not just like, okay, I'm going to take a breath. Okay, now, because we can do that. No, a purposeful pause is really being mindful, is truly stopping yourself in your tracks. Even if you've already started to lose your mind, mommy's coming back now. You little children, make sure everyone is safe. If you can leave the room, excuse yourself to a bathroom, the kitchen, get a glass of water. If you can't, just create some physical distance from whatever is happening around you so you can still keep eyeballs. Take a breath. Tune into your physical body. What part of my body is having a reaction to this moment outside of me? Maybe then take your hand. If you have a headache, a heartache, a stomach ache, place your hand there. Take a few breaths. What do I need right now? What does my body need right now? Be kind and loving to yourself in the moment. And when you're calm, you can step back to your children or your partner or your boss or your colleague and be like, okay, I couldn't talk a minute ago, but I'm ready now. Right? If it's with your children, get down to eye level or below, because we don't want to be over them. We want to be eye level or below, because your calm nervous system regulates their nervous system. And that goes with anyone, because autonomic nervous systems talk to one another silently, right? So if I'm in a heightened state, you're going to get in a heightened state. If I'm in a calm state, you will calm down. So that purposeful pause, if the audience takes nothing away from this podcast except that, I will be thrilled, because it is a superpower when you can learn to use it.
It really is. And I can't amplify this enough. In your book, you talk a lot about the importance of self care. And a lot of us struggle with, oh, but that's selfish. I can't do that. I have to take care of my aging father who has dementia, and my father in law who has cancer, and my kids, and my job. And so, can you please just help us have permission to do this purposeful pause? This, my favorite mantra, I'm going to put on t-shirts, and I'm actually not kidding. Self care isn't selfish.
Exactly.
Yeah. So share your thoughts about that. Give us permission. We need it.
We can't give to someone else what we don't give ourselves, right? So if you are on empty, how can you take care of your aging father, your sick dog, your toddler, even do a good, competent job at work? How can you? You're pulling from an empty tank. You're going to be burnt out, stressed out, emotionally worn down, and probably not using really good coping skills. I would imagine you could be overeating, you could be overusing alcohol, maybe drugs, overusing social media, maybe sleeping too much. So then you're creating other obstacles, which in a way hinder you, because now you have less time to do the things you need to do because everything has to get done because you've spent so much time not doing self-care. And self-care doesn't have to take a long time. Go outside for 5 minutes, take a few breaths, point your face to the sun. Even if you live in a cold weather climate, go outside in the snow for 5 minutes. Go look at the water. And actually, because the unconscious mind does not know real from imagined, and this has been researched and studied, you can actually watch YouTube videos of nature, and that will have the same calming effect as actually physically being in nature. So
I
someone,
love that.
yeah, yeah.
It's using social media for good instead of evil. There actually are useful things out there. I have done that. I'm like, I am feeling really stressed. I'm going to look at a lake or some puppies or something like that, where I have made that conscious choice to utilize this tool to get myself back into state. So I love that you are helping people see there are good to social media. And then there are times where it's more destructive. There's both.
It's both. It's a both and. We live in a both and world as far as I'm concerned.
Yes. Oh my goodness. So that self-care isn't selfish. And so I think even those micro self-cares really help people start to learn to strengthen that muscle and realize it's okay to do those things. I joke with my residents. So I work in a teaching hospital, and I tell them that I am a much better doctor with a full stomach and an empty bladder. And they always laugh, but it's true. If you are there as my patient having the worst day of your life, and I'm antsy because I gotta go. Listen, I've had 2 kids, bladder's not what it used to be, and I'm starving and I'm grouchy. You don't show up as your best self. And so those micro self-care and macro self-care. So if you're teaching somebody how to really strengthen that self-care muscle, how would you share with people how to do that?
We have to pay attention to what's going on within us and around us. And I think routine is important. How are you starting your day? Are you hitting snooze and not giving yourself enough time in the morning? Or maybe you can give yourself 5 minutes, even if you just lay in bed quietly for 5 minutes because you don't want to get up, but you're awake. And like, okay, this is 5 minutes of me time. You know, are you immediately on your phone or computer or turn on the TV? Or do you sit quietly with a cup of coffee or tea? You know, when you're in the shower, do you just let yourself be in the shower? You know, and the shower, washing dishes, that can be a meditation. You just are with it. I forget which Buddhist monk had said this or which philosopher, and I'm sorry, I can't remember where it's from exactly, the source, but I'm giving a source I don't know. But he would say, you take one dish, you focus on the one dish, you wash the dish, you wash the dish, you put the dish down, then you go to the next one. You don't worry about the pile of dishes. It's one at a time. And so it's the same thing. So we don't need a lot. But if you don't give to yourself even a little, you have nothing to give to anybody else. Because see, people blame the other person for triggering them. It's your fault. This happened to me, that happened to me, and we become the chronic victim. But a trigger actually has nothing to do with what's outside. A trigger happens inside because of what happened on the outside. So I actually don't like the word trigger. I much prefer to say we got poked. And I feel like sleeping lion inside of us got poked, and then we roar and scream and yell and react. And then we reenact something from where? Oh, the past. Why are we reenacting something from the past? Because what's happening in the present moment feels familiar to what happened when I was 10. And because the unconscious mind has no sense of time, guess who's running the show of your 40, 50, or 60-year-old life? Your 10-year-old. I don't want my 10-year-old running the show of my life.
Oh, yikes. Definitely not.
You really start looking at people. We have a bunch of 10-year-olds running the world, running offices, making decisions, because their activated inner children are acting out because you never took care of your own inner pain.
Yeah. And knowing what those triggers are, some of them, you're very consciously aware of. Some of them I assume you're not. And I tell this example to my kids because it's funny. I was at work one day and one of my colleagues was teasing me that I had a big butt. And I don't objectively. And I had just come back from pregnancy where he knew that I was vomiting and lost a bunch of weight during the pregnancy. So he knew that he was teasing me about something that wasn't real, like calling a giant guy tiny, right? So I wasn't triggered at all. I just kind of, I didn't even turn around and look. I just laughed and kept doing what I was doing. But one of my other coworkers in the room stood up and like, that was rude. You need to apologize. And I was like, oh my gosh, they were defending my honor, which was super sweet. But I was like, oh, but that I don't have that. So it's okay. But there are other things that I know that if that same coworker had poked, I would have gotten real spicy. Like immediately, I would not have thought it was funny. Now, this is someone who I consider a friend, so I know that he was just kidding. But even though, those joking things, man, if it's something you don't like, poke, poke, poke. So talk to us about that.
It can be anything, though. It really can be anything. So it's impossible, actually, Jamie, for me to give a list of like, what are the triggers?
Oh, yeah, of course. Yeah.
The triggers aren't happening in the present moment. Like, okay, yeah, the doctor made a joke about your butt, but if you would have gotten triggered, it wouldn't have been about his comment in that moment. It would have been because when you were 12, some kid at school made fun of you for your shape, for your weight. And that's why you would have got upset. You said, I don't have that, so it's okay. That's not a trigger for you, but for somebody else it would have been. And it's not a trigger for you because there was no previous emotional pain associated with your body in that area.
Exactly. But believe me, I have quite a list of other things that that it would. He just happened to find the one that didn't. So, okay. So say he had poked a different kind of lion, something that I really did. And gosh, where do we even start on that list? So now I'm in state, all of a sudden my 10-year-old that's hurt, that's like, that was so mean, comes right out. Now they're taking control of I'm a physician, I'm a mom, I'm a responsible member of society, but now I've got a 10-year-old running the show. Now, what do I do?
Just that purposeful pause. We come back to that pause. And all right, you're working in an ER and it's hard to slow down, but you could still put your hand on your heart and say to your 10-year-old, it's all right, I got you. I see you. I hear you. I'm here with you. I'm going to take a break in a few minutes and I'm going to take care of you. Because when we act out, when we yell, we scream, we cry, we direct our anger or rage at somebody else, I like to view that as your inner child raising their hand saying, hello, I'm here, calling you, pay attention to me. Because I could almost guarantee no one paid attention to that child within you at the age that they were at that time. So they're still looking to feel validated, seen, heard, and loved in some way. And now that we're grown-ups, the only person that can do that for you is you. But people look to their partners, their children, their bosses, their colleagues, their friends to take care of their pain. And then those people are always going to fall short because no one's ever going to meet that expectation. And that's just going to then hurt more. And you go into the whole spiral all over again.
And on one hand, it can sound scary, the whole no one's coming to save you thing. But on the other hand, it's so empowering because then you don't have to wait. There are people in my life that I'm still waiting for validation from, and that's probably going to be a really long time. And so to learn that if I'm not waiting for them.
That's right.
So you teach this in so many different ways. You've got workshops, you've got articles, you do, the conscious parenting. So I would love to kind of migrate over toward the conscious parenting because you can parent your young children this way. There are many listeners who have adult children, some of whom are now back in the home, sometimes even with now their children. And it's never too late. Of course, the best time to plant a tree was 20 years ago. Second best time is today. I can think back and spiral out on all the mistakes I've made parenting. or I can learn from that and become more conscious. So, what would that journey look like for our listeners if they want to start going down this pathway?
Yeah, I love that. Thank you for the opportunity to talk about conscious parenting, because conscious parenting is not about the kid. It's not about your child, no, whether they're 5, 12, 20, or 40. Conscious parenting is about the parent. And conscious parenting says there's nothing to fix because nothing is broken. So the only one who can change is you, the parent. And if there's a problem in the relationship with the child, no matter how old your child is, you have to look within yourself to say, what am I in pain over? What do I need to address within me? Because I'm just acting it out in the relationship with the child. Maybe you're really working hard to control your child. That's going to backfire, no matter how young or old your child is. If your child is young, the more control, the more lying you're going to see. If they're older, your teenager or young adult child is going to pull away, shut down, not talk to you. Conscious parenting is all about connection. Where and how can I meet my child where they're at? Well, my child always ignores me. Do you get eye contact before you talk to your child? Are you yelling from another room? Do you even know that they've heard you? Right? Well, they want peanut butter and jelly for breakfast every day. And what's wrong with that? Right? Nothing. It's just we've grown up with beliefs, and we're all indoctrinated by culture. And that influences how we parent. And unfortunately, all of us were parented by unconscious parents, right? You buy a new car, you read the user's manual, right? You get a pool, you learn how to use the pool filter. We get a cell phone, we figure out how to use it. When you give birth to a baby, no one gives you a user's manual.
They just let you take this infant home.
Oh my.
Right?
I remember when I took my daughter home, and again, that was after years of infertility. My husband and I bring her home in the baby carrier. We stick her on the kitchen table, and I'll never forget this moment. And I go, now what? What do we do with her? What do we do? What do we do? We don't know what to do. And it's not the what to expect book on, how to feed them, change them. There's no emotional handbook, because what we don't know when we become parents is that it awakens within us all our emotional wounds. And if you don't deal with it, we act it out on our kids. I've had people come to work with me around conscious parenting who've had children in their 30s. And after just me hearing the stories and giving them feedback and giving them some tools, because coaching is much more tool oriented, you're going to get tools to use and implement. They noticed after a few short weeks, things begin to change in the relationship. All of a sudden, their daughter, who never picked up the phone and called them, is all of a sudden calling them, because they were looking to make a connection as opposed to correction or control. And
That's huge.
That's the difference.
And I struggled with that because obviously I always know the right way to do everything at all times in my house. You can ask anyone who lives here. That if you want to correct, you want to teach, like every second as a teachable moment, and that's just exhausting for everybody involved.
It is. And the kids don't want that. They need to learn their own autonomy. The way they're going to learn is through naturally occurring consequences. You forget your homework, I'm not rescuing you. That's just what it is. It's just forgotten. Maybe you won't forget next time. I can't.
And I love that. I'm here in the background. You can't see me on YouTube, but I'm like making like triumphant gestures because it's so helpful. There are natural consequences. It's not a punishment, a choice. Like the time my son ate way too much junk at a party and felt like garbage the next day. It's not like, haha, you feel like garbage, but now you know why I try and teach you to regulate and enjoy treats, for goodness sake, they're delicious, but have a reasonable amount versus an unreasonable amount so you don't feel that consequence. And Without that, 1,000 lectures of me telling him to eat less junk would have never sunk in.
Exactly. Yeah, that's a great example. That's exactly it. So whatever it is. Now, do we have to have concrete boundaries sometimes? And you're not going to let your child get in a car without wearing a seatbelt or ride a bicycle without wearing a helmet. These are life affirming boundaries and we need them, right? You're going to brush your teeth or you're going to get cavities. These are things we have to do. You have to drink water. You're going to get dehydrated. We don't want to learn the hard way, these things. So there are definite boundaries that parents have to have that must be concrete, but they're very few and far between, right? Safety, enough sleep, maybe keeping your environment neat if that's a value in your home. Everything else, that's just ego. That's just the parental ego wanting to brag. My kid's the best piano player, or the quarterback in football, or the A student. I always told my kids grades don't matter. And everyone in my life like couldn't even believe I said, and that was even before I knew about conscious parenting, because grades don't matter. I don't want my child to define themselves and their worth based on a grade, which is someone else telling you how well you did. If you want to get good grades, that should be intrinsic, not external. So parents have to understand, where are my belief systems coming from that I'm imposing them on my kids and thinking my way is the only right way, right?
Oh, absolutely.
So much more to conscious parenting and so much more. And we could discuss it for hours and hours. And
Oh, yeah.
done. But
We're just scratching the surface here. I feel a part two brewing.
Oh, lovely. I would love
Because
that.
I think this is really important. But what I'm hearing, whether you're using a tool like hypnosis, whether you're doing coaching where you have, tools and homework, or conscious parenting, the first step, there's a lot of acceptance, like meeting you where you're at, instead of trying to correct and redirect and yell at and shame yourself for having feelings and overwhelm. It's that some type of level of acceptance. It's taking that purposeful pause and then starting to strengthen those self-care and conscious muscles.
Yeah, 100%. Like, I can't separate it all. It doesn't, for me, being a clinician, as many years as I've been being a hypnotherapist and a coach, when I learned parent coaching, conscious parent coaching, it was like the final piece of the puzzle that went in it was missing. It tied together the psychotherapy work I do, everything I know about psychology. It tied together hypnosis. It tied together what I know about inner child and how that all plays out in real time for parents and even people who aren't parents. It doesn't matter because it's all about the self. You don't have to be a parent to be a conscious parent. What else isn't like the way you want it in your life? Let's look at it. So for me, it's been like kind of an alchemy of putting all of this together, which was why I wrote my book, because I finally had all the pieces for me. Not that
Yes.
there aren't always more pieces. There are. This is not definitive. There's no be all and end all. It is not a self-help book. To me, it's a self-growth book. And let's just keep growing because there's no destination. I hate to say it. People want to know, when am I going to heal? When am I going to feel better?
Like next Wednesday at 5 p.m. No, it doesn't work like that. It's a journey. So the book is Show Up for Yourself. And Janet Philbin, where I know our listeners there are a lot of people who heard this. And what is the word for a positive trigger? They're like, oh, that's me. I'm the one she's talking to, and I want to do more of that work. Where can they find you?
Yeah, the best way to find me is my website, which is janetphilbin.com, Philbin. You can find a link to everything there and start there.
Yeah, I mean, looking at this, I have it up on my other screen here. The workshops, the articles, the meditation, you can schedule a consultation. I love that. First of all, whoever your web designer is, like, big props to that because it's so easy to use. It's so frustrating when you go to a website and you can't find a dang thing. And on here, I feel immediately like I'm getting help. So I'm not joking, like the difference in somebody's design. But so there are a lot of tools that people can use. You are a guide that can help people on this journey. And so you combine that science of the counseling, the science of hypnotherapy, your personal journey, and the decades of experience with your patients, and put together this really fantastic methods.
Thank you. Yeah, it's exciting. I really love working with people and helping them reach their goals, whatever those goals might be.
It shows in your work, and I absolutely love that. So everybody stick around for your takeaways and your free gift. Janet, thank you so much this was packed full of free takeaways and actionable items that we can use in our real life today. Thank you so much.
Thank you for having me, Jamie. I've truly enjoyed our conversation.
Thank you for tuning into Navigating Hope with me, Dr. Jamie H.O.P.E. It has been an honor to navigate the realms of health and wellness with you today. Remember, in the journey toward a healthier life, knowledge is your compass. If you enjoyed our time together, please share, like, and subscribe to Navigating Hope. Join us next week where we'll continue to empower your health journey, arming you with the wisdom to navigate life's challenges and keep the emergency room in your rearview mirror.